Okay, Assalamu alaikum guys. My name is Shafi. I'm a medical doctor working in the NHS. And today I'm just going to be giving you a brief overview of coronavirus. This is mainly for our local community in Bedford. And I work for the NHS, but this video is my own opinion. It's based on my own medical qualifications, my own medical experience, and it doesn't represent the views of the NHS. Okay, so I'll just quickly go over a few things about coronavirus itself, which you should be aware of, and some of the things to look out for, ways to try and help yourself, help your family, try and prevent it from spreading, and also some of the treatments, some of the things that you can do to look after yourselves. And then inshallah we'll be going on to talk about some more specifics in terms of ghusl, and also precautions that need to be taken for people that are involved in ghusl, if you will be doing that for your deceased ones. Okay, so first of all, coronavirus itself, many of us are already aware of the symptoms, signs. Unfortunately, it's something which shares a lot of commonality with other conditions, especially flu and common cold, so influenza and the common cold. And some people don't have any symptoms. The most common symptoms that we're finding in the medical community is that people have a dry cough. Some people have shortness of breath. They find it difficult when they're walking upstairs or doing long walks. And an odd symptom is that some people have a change in their taste when they're eating food. So they might have a metallic taste, or their smell might go. And again, that can happen with the flu and common cold also. So there's a big overlap in these things, and the vast majority of people, just to reassure you, won't have any problems with coronavirus. The percentage of people that it affects severely is very low, and it generally affects those people who have got underlying medical health problems. So problems with, breathing problems with their lungs, so asthma, COPD, heart problems, diabetics. Those are the patients that are generally more affected, those that are severely overweight. So the general kind of population, they'll have a mild illness, or they'll have a slightly severe illness, but they'll get through it and they'll be absolutely fine. So it's scary sometimes when you see all these news reports of, young people dying, people, they've had no medical issues, which is true, and it can happen, and that's from Allah. It's all from Allah. So with these things, you've got to bear in mind, when we look at the numbers, generally across the country, it is extremely low for somebody who's fit and healthy, otherwise with no medical underlying problems, to succumb to this. So, try and allay your fears and anxieties a little bit, and don't get too worked up about it. The people that we should be protecting are those that are vulnerable, because for them it is serious, and there is a lot of misinformation about it's not that serious and it's the same as influenza, and a lot of it, there are some truths to that. It can be that when you look at the numbers, it can be quite a similarity to influenza, but the biggest difference is that there is no vaccine, and this spreads a lot more quickly, and it overwhelms healthcare systems. So we don't see ITUs full of people on ventilators from influenza. That's a big difference. So normally we'd have ITU full of people with other conditions. We'd have a few with influenza, but not on the scale that we're seeing. And this is mainly due to the severity in those that are at risk. So going back to the symptoms, the main things to watch out for are dry cough, shortness of breath. You might be feeling generally run down, muscle aches, muscle pains, not being tired, not being able to do anything. And with a lot of people, they get this initial phase of symptoms, and then sometimes around a week later it can come back again. And the main thing to say is that if it does come back around day 6, day 7 of after your illness, that's when you should really be seeking medical attention, because that's when the illness can become more severe, especially if you're elderly and you've got one of these underlying health problems. Moving on to some of the ways that you can look after yourself. So the main things that people should be doing is that they should be looking after their diet and nutrition. Okay, because that's the only thing that you can really control, and it's something which isn't really emphasized much by a lot of medical professionals, a lot of people in the healthcare profession. The first protocol for most people is tablets and medication, but actually if you're looking after yourself in terms of what you eat, then your immune system will be strong, and inshallah you can fight off the infection quite easily without any problems, even if you're elderly and you've got underlying health issues. So I'm talking about, drastically cutting down on oily foods, processed foods, things that can sit on the shelf for months, without expiring. That's a processed food, that's not real food. You need to be eating your fruit and veg in terms of 6, 7, 8 portions a day of fruit and veg, not just 5 a day is, what they mention. You should be aiming for more than that. Okay. Keeping well hydrated all the time so that everything is flushed out of your system quickly, and making sure that you have a balanced diet, so not too much meat in your diet, not too much oil in the diet, more fruit and vegetables in the diet, and all of these things will increase and boost your immune system. There are some natural remedies that a lot of us recommend. Manuka honey, twice a day, and taking fresh ginger in boiled tea. That's another thing which helps the immune system as well in small amounts. You don't want to overdo it. So all of these things in moderation, but generally speaking, if you're exercising, eating well, looking after yourself, getting enough sleep, trying to avoid stress and anxiety as much as is possible, then all of these things will boost your immune system, and inshallah prevent you from having a serious illness. And a lot of us have already had this and we don't even know it. So again, there'll be a big proportion of the community who have already experienced this, and who've overcome it. And inshallah, when the testing comes round, people can find out if they've had it. At the moment, that's not available, and that will, allay a lot of fears for a lot of people. So moving on to some of the treatments. Like I said, if you still have symptoms after 7 days, so if you're still feeling run down, you've got a headache, you've got a cough, you've got a cold, you've got a temperature, high fever, then that is the kind of time when you need to be seeking medical attention. Obviously, you need to be seeking it before then if you're at a high-risk group. So again, if you've got diabetes, if you've got heart problems, if you've got breathing problems, a lung condition underlying this, or if you're elderly, if you're pregnant, you should be seeking medical attention from the outset, so from the beginning. Whereas if you're generally fit and well and your symptoms are persisting, despite you having this problem, then that's when you need to be seeking medical attention, and seeing if you need to be seen by a doctor. Calling 111 is the first point. Once you have been checked out by a doctor, sometimes they may think that you need admission. If they do, then it's usually based on your oxygen levels and your temperature. They need to get it under control, and also based on if you've got underlying health issues. If you've got the illness at home, and you're obviously suffering from it, you can obviously take things like paracetamol to lower the temperature. It won't make the illness go away quicker, and it won't change the outcome, but it will definitely help with the, just generally how you're feeling. There is a lot of evidence that suggests having chicken soup really helps, especially with ginger in it. That again boosts the immune system. Manuka honey helps the immune system. That's something to have. A lot of people recommend black seed oil. You can buy that in capsule format, or you can get it in the seeds, which you can use in hot water or tea. And of course, that is a sunnah. And there is a lot of evidence which suggests that that does work. But none of these things are a replacement for medical attention. So if you're severely unwell or you've got underlying problems, then you should be seeking medical attention for this. We do recommend at present you avoid ibuprofen if you have got a temperature, or you're not feeling well and you think you may have coronavirus, because again, in a small percentage of people, it may affect them adversely, and it may lead to other problems. Okay, so a few other symptoms which are less common, but are also worth mentioning, and I didn't mention them at the start because they are less common, is that some people can get general kind of cold-like symptoms. You can get sore throats, runny nose. Now, this is less common with COVID-19, but it can still happen. The other thing is that some people can get a GI disturbance, meaning that they can get nausea or vomiting or even diarrhea with COVID-19. And again, it's far less common, but it is something that can happen with the illness. In terms of when a family member is actually admitted into hospital, it can be quite difficult, especially the restraints that are put on. Now, it's quite variable in terms of how much interaction you can have, but generally there are no visitors for a patient who's got COVID-19. In terms of variability, there's some nurses, some consultants who are a bit less stringent, but the general kind of policy is that there is no visiting because of the level of equipment that's required for you to have an interaction. And this should be followed, because even though it's difficult, it's something which is done for not only your safety, but safety of the community and others around you. So going along with that, in terms of government guidance and government policy, that's obviously social distancing, which I think generally is being followed quite well. The ruling is that if you've got symptoms, then you should be self-isolating for 7 days. Now, the World Health Organization actually recommends 14 days for this, so 7 to 14 days is a fair amount. If you're living with somebody who's got symptoms of a flu or a cold or COVID, because again they all overlap, then you should be self-isolating for 14 days as a minimum. The current government guidance is that unless you're a frontline worker, you should be minimizing your outings, so only going out for essential reasons, which is to the supermarket to get food and supplies, to the pharmacy to get medicine, and to do one exercise a day, which you can do outdoors. If you can do it indoors, or if you can do it out in your garden, that's even better. And if you're in a vulnerable group, then there is good evidence, although not currently endorsed by the government, but wearing surgical mask at least. So especially if you're elderly or you've got an underlying health condition, then to do that as a minimum, because not only will it prevent or reduce the risk of you getting the virus, but it also protects the community as well, because if you do have an illness and you don't know and you're asymptomatic, then it can help prevent the spread of the infection also. So like I said, inshallah, the majority of people who do contract the virus, and eventually it will be the majority of the population will contract it at some point, will be fine, and inshallah they'll survive. And even those that are admitted to hospital, the majority of them, with medical treatment, inshallah, will pull through. However, of course, there will be individuals from the will of Allah who will not make it, and for those individuals, for their family, it will be an extremely difficult time, and it is a time which is unprecedented and strange for all of us. No one has been through this before. No one is used to this. All our customs, everything is changed, and therefore we have to adapt, unfortunately, to the situation. In terms of the deceased, the body will be taken from the mortuary to the undertaker parlour. If ghusl is being performed, this is the only time family members, whoever is involved in the ghusl process, will be seeing the deceased and the body. At no other point, sadly, will any family members be able to see the deceased. From the ghusl khana, the body will then be taken to the cemetery. At the cemetery, the janazah, at the moment 10 people maximum are permitted to attend, which will be decided by the family of the deceased. No more than this. Afterwards, once the burial is completed and the funeral process is over, then of course anybody can go and visit the qabristan, to the funeral, to the cemetery site, and make dua there, as long as you're following the government guidance in terms of social distancing, and obviously not going together as kind of big family units with other people from different households all mixing. It should be individuals, 2 to 3 people at the most from the same household who are going to the qabristan until everything is lifted and until the government advice changes. At the moment, as of April 2020, the government advises that funeral rites Islamically can be followed for the different religious groups, and there's been no restrictions put in place. If this changes, then obviously we have to follow whatever government guidance there is to the best that we can follow it. So in terms of the specifics of the ghusl, if somebody does pass away, the specifics pertaining to the ghusl in terms of the medical aspect of it, obviously the Islamic aspect of it and the Islamic ruling of whether you should be doing ghusl or not, that is something which is down to the imams and the muftis. But in terms of the medical side of things, and how you can protect yourself, what are the risks, who should be doing it, who should not be doing it, these are all things which I can quickly run through. So again, like I said, this is my personal opinion from my medical experience, from my medical qualifications. Some people who are doing ghusl in other parts, they may think this is overly cautious, or overly extreme. But these are all my opinions in terms of how you can maximize safety and minimize the risk of spreading it not only to yourself but also to your community, your family, your household. So some of these things might seem an extra step or an extra mile, but these are all things I think which are pertinent. So the first thing to say is that obviously procedure is not without risk, and that's why you have differing opinions on the ghusl itself and whether it should be done. Although the virus itself, we know, can survive for 2 or 3 days on plastic objects or other objects which are non-living, it is still a novel virus. We still are learning a lot about it. In the body, it can survive for we don't know how long. Okay, so we assume minimum 2 or 3 days. Possibly it could be longer. Generally speaking, with viruses, they don't survive in a deceased body for very long. Okay, but again, with coronavirus, we're not sure. And only this week, there's been a report in the medical literature that a doctor performing an autopsy, which is obviously a lot more invasive than a ghusl, contracted the coronavirus from doing an autopsy. And of course, they were fully wearing the full PPE. So, things can happen. But just to kind of reiterate, the ghusl itself and handling of the deceased is deemed a low risk procedure. In terms of who can do the ghusl and who shouldn't do the ghusl, the risks are obviously to those who have underlying health conditions. Okay, so anyone with an underlying health condition, which I mentioned previously, shouldn't be doing ghusl. So those with diabetes, those with any heart conditions, those with any liver problems, any kidney problems, those with a respiratory condition such as asthma or COPD, which members of the elderly community who have been smokers in the past may have. And often some of these people, it's undiagnosed. Not everybody has a diagnosis. They just have a cough all the time and they don't know what it is. So you have to be very careful. And of course, finally, those who are elderly. So the kind of general consensus is that anyone over the age of 60 should not be doing the ghusl. But in my opinion, anyone who is from the Asian community, from what I've seen medically, is that the Asian community seems to be at higher risk from coronavirus for reasons we're still elucidating at the moment. But anyone over the age of 50 who is from the Asian community, in my opinion, should not be performing the ghusl at all. After you've done the ghusl, then again, I feel that there should be a period of self-isolation for anybody who's done it, because again, a small percentage of people will be asymptomatic, even if they've contracted the virus. Again, the risk of contracting it is extremely low from doing ghusl, but if you have contracted it and you don't have any symptoms, you can be passing it on. So self-isolation for 14 days, especially from elderly relatives and relatives with underlying health conditions, pregnant women, etc., is advised. When you get home after you've done the ghusl or after the cemetery after you've handled the coffin or any kind of risky procedure, any clothes that you're wearing, before you go into the living room or the kitchen, or you start touching things in the house, first thing you should do is go straight into wherever you can remove the clothes and then put them straight into the wash and then have a shower preferably. Again, these are just extra precautions which will try and minimize the risk as much as possible from spreading the virus. If you have accidentally touched something or accidentally got it onto your hands or your clothes or something like that, then you want to minimize the risk as much as is possible. So in terms of the level of PPE which should be donned when you're doing, or should be worn when you're doing the ghusl, there'll be 2 people who are involved in the actual ghusl itself, and there'll be a third person who's helping. So the kind of government guidance is that for any non-autopsy procedure, i.e. a ghusl, you can actually classify as a non-autopsy because you're not doing anything invasive to the body. There should be a minimum level of PPE worn. Okay, even when you're handling the deceased, or when you're handling the coffin or anything like that, and that is that you're wearing a pair of surgical gloves, you're wearing some eye protection, you're wearing a surgical mask, okay, so similar to this one here, and you're wearing a at least an apron. Okay, so that's the kind of minimum thing. So the person who's helping should be wearing this, as a minimum in the room. The people who are performing the ghusl, again, they should be wearing all of this. When we talk about people doing an autopsy, there's an additional level of PPE that's required. So these are doctors who are doing autopsies, quite invasive procedures. Additionally, they wear special masks which form tight seals, and these are often called N95s, or some call them FFP2s. There's different versions of these. Ideally, in a ghusl situation, whoever's doing the ghusl should be wearing those masks, not just the surgical masks. As a minimum, you should be wearing a surgical mask. But in the most ideal situation for those two people doing the ghusl, they should be wearing something which is forming a seal and no air is escaping around. In terms of the other additional thing, that for the two people doing the ghusl, they should be wearing a surgical gown, which is what we wear in practice when we are treating patients with COVID-19. But in the ghusl situation and in other places, we know that you can get hazmat suits, which is what we have here today and which we'll show you today. And the kind of last thing to note is that even those that are involved in the janazah, so with the coffin at the cemetery and other places who are touching the coffin, they should be wary that although the coffin is disinfected and it's cleaned, and therefore the risk of passing something on is extremely low. It's not completely ameliorated and it's not 100% risk-free. So you should be wearing surgical gloves if you can, and if you are handling the coffin, and a surgical mask as a minimum. And then of course when you get home, follow the same precautions as I mentioned before. Remove the clothes and then wash them, just as an extra safety precaution. And like I said, all of these things are trying to maximize safety and not doing the bare minimum, which is often what is done, and then that could lead to problems in the future. Okay, so now inshallah I'm going to demonstrate to you how to don PPE, which is the protective equipment that you need to be using. So this demonstration is what we do in the hospital. Okay, so it's what I do as a medic, and therefore, it probably is a little bit different to other institutions or masjids who are doing ghusl for COVID patients, and they may have their own routine, their own different equipment. So this is just for our local community to show them what medics do to try and maximize safety for themselves. So the first thing is obviously you need to make sure you've got the right PPE. Okay, so like I said, for the people performing the ghusl, you need to be having, as a minimum, a surgical mask, but ideally for the people performing the ghusl, you need a special respirator mask. Okay, you need to have gloves in the right size. Okay, you need to have a visor covering the face, or a pair of goggles. And again, in the hospital, we use surgical gowns, which are different to these, but this is some people call it a hazmat suit. And it should be sufficient for the process of doing ghusl, but we don't use these in the hospital. So again, it's not something I'm that familiar with. So I'll quickly run through how I would don this in a hospital setting. I've made sure I've got the right size for myself. If you've got long hair, you need to make sure it's obviously tied back. If you've got any jewellery on in the face, it needs to be taken off beforehand. If you've got any watches on or rings on or anything like that, that needs to be all removed beforehand. Okay. So the first thing we'll do is we'll give our hands a wash. Okay, make sure the hands are fully sanitized. Okay, and then take the suit. Okay, so you see this is the suit on now. So for demonstration purposes, we only have this size suit at the moment, but you should be making sure that you have the right size suit. This one's actually a little bit small for me because it should really comfortably coming up over the wrists, so you're fully kind of covered and protected. Okay, you can put the hood over your head. At this point, if you wear glasses, you make sure you take them off at this point. Okay, and then you pop them down somewhere where you can access. The next thing we'll be doing is putting on the face mask. So again, as I mentioned, ideally you would have a respirator mask. And I'll just tell you how you would put a respirator mask on. Normally it comes with a nose tip at the top, so the nose tip would be holding it almost like an upside down cup or an upside down plate, and you'd have the nose tip around your fingertips. Okay, so you're holding it like that. Okay, and it has two straps. You put it onto the face. The top strap goes above the ears, okay, and the bottom strap goes below the ears, and then you put the hood over it once you've done that, so that the straps are actually on inside the suit. Okay, so what we've got here at the moment is the surgical mask. The other thing with the special respirator masks is that you then form a tight seal with the nose, so you kind of seal it in, okay, and then you do a fit test. So what we do in the hospital again is that we hold it down and we make sure we blow quite hard and exhale deeply, so we can see if there's any air escaping. If there is, then we readjust to make sure that it fits properly. In this case, we've just got a surgical mask, so we'll just use one of these for demonstration purposes. Okay, so now putting on the mask, so just bringing it in. See, it goes around the ear straps like that, making sure that the nose piece is nicely molded in, and it should be covering the entire face like that. Okay. Okay, then if you have glasses on, then you can pop the glasses on now. You can also at this stage pop on your protective face wear. So again, in this case, face visor there, like that. Or as we mentioned, you can be using goggles as well. Okay, so the next part is putting the gloves on. So again, you want to make sure that the suit is as high as possible up here, so that when you put the gloves on, the gloves are overlapping the suit, so there's no gaps anywhere. So you can see here that it's just about covering, so the suit is a little bit small. Ideally, you'd want that to be higher, so that when you move your arm around, that doesn't happen. Okay? And again, same with the other one. And ideally, if you have the surgical gloves with the long ends, you can actually get them up all the way, which is more ideal. Because again, if I'm moving around, gaps will appear, and therefore this is not adequate. It should be fully sealed within that. Even if you're moving around freely, you have no gaps occurring. So then I'll put on another pair, so I have two pairs of gloves on after this. Okay, so obviously that was how to put on the protective equipment. The second part is removing it in a safe manner, so you don't avoid contamination. Ideally, you should have another person watching you to make sure you don't accidentally touch yourself or your clothes and contaminate yourself, because as you're removing this, sometimes it just can't be helped and you don't know that you've done it. So it's always good for another person to just watch you and make sure that that's not happened. So the first thing we do is we've got two pairs of gloves, and I've only got one on at the moment, but imagine I have two on. So you take off the first pair of gloves, put it into a medical waste bag or a clinical waste bag ideally, okay, for disposal, and then we can remove the hazmat suit, okay? So the first thing, so first of all, removing that down that way, unzipping, and what you want to do is you want to make sure that you're not touching the inside of the suit, you're only touching the outside with the pair of gloves, okay? So at all points, you're only touching the outside. And you're taking it off in a manner that everything is inside out, okay? So everything is coming off like that. So you can see as it comes up, everything is just coming out inside out, okay? And then the last thing you do is you take the gloves off, and again, when you take the other glove off, if it hasn't already peeled off with the suit, as it should do normally with the long sleeve glove, is that you can take it off from the inside. So you put your finger on the inside, you don't touch the outside of the glove at any point, okay? So it's all on the inside, okay? And again, that goes straight into the clinical waste bin, okay? At this point, you wash your hands again. Okay, so give them a good wash. Okay, and then you can take off the visor. So again, you're doing it from the straps, so you're not touching the front case, front cover. And again, into the clinical waste bag. And then ideally you'd wash your hands again for a third time. And then when you take off the mask, you want to make sure you do it from the straps, okay? So at no point did I touch the front face of that mask. Okay, it was always just the straps at the back there. Okay, and again the same if you've got an N95 mask, the same thing. You're only touching the straps at the back, because it's the front which is contaminated, and then that goes straight into the waste bin. Okay, and then when you leave the room, you obviously wash your hands again thoroughly all the way through, and then if you're going home after that, as we mentioned before, you follow all the precautions that were mentioned.